What do you see as important for physicians to think through as they're building their practice? Not just, serving, helping them with their patients with mental health, but helping themselves, right? Kind of navigate any issues that they may have. What do you recommend for as you talk on social media?
We just have to be mindful that patients' emergency or their urgent concern is not always the priority in reality, like in big picture. Setting boundaries, letting patients know what the expectations are, that they should have of you and you of them as well, is also important.
Hey everyone, welcome once again to Medical Success Secrets. I'm your host Theo Harvey, and I have another fabulous guest with me to talk about secrets of healthcare, but more importantly, how you can be productive in this new normal of healthcare. With me today is Dr. Clarke. She is a board certified family physician and volunteer adjunct clinical instructor of medical education for the Keck School of Medicine at USC. As a Los Angeles native, she passionately provides care for individuals experiencing homelessness in downtown on Skid Row in Los Angeles. She received her Bachelor's of Science from Xavier University of Louisiana in New Orleans, and she earned her medical degree from the Creighton University School of Medicine in Omaha, Nebraska. After a non traditional journey of medical practice, she completed her family medical residency at UC Irvine in 2017. Receiving a late diagnosis of ADHD at 35, Dr. Clarke enthusiasm as an advocate for mental health and ADHD. Born to Help People Like Me is the story of Dr. Clarke's medical journey featured in the American Board of Family Medicine Stories of Family Medicine, Health Equity, and Action series. She's also contributing author of her first book, Black Girls in White Coats, Black Female Doctors, released in April 2023, which inspires Black females to pursue a career in healthcare. Dr. Clarke, thank you for joining us today.
Thank you. Thank you so much for having me, Mr. Harvey. I appreciate your time.
Awesome. No, thank you. Thank you. So let's get into it. I mean, look, mental health is definitely a crisis right now. Some of the last statistics I saw back in 2023, survey by American Medical Association or AMA, said that more than 60% of physicians are reporting feeling signs of burnout and 35% experience mental health struggles, many not seeking any help themselves, right? And
Right.
so what is your experience with the mental health challenges during your medical journey, right, as a professional, but also as you talk to other patients? What are you seeing in this epidemic that's happening right now with mental health?
So, yes, I'm Dr. Clarke, and I call myself the patient and the clinician, meaning essentially right after medical school, when I graduated from Creighton in Omaha, Nebraska in 2005, about 6 months into my training, I experienced a downward spiral in regards to my emotional health. I was very overwhelmed by the long work hours. I felt like I didn't belong based on me being a minority physician in a group of, non-minorities, just overwhelmed, burnt out, and I had never had any mental health challenges prior to that. So I'm 26 years old, nothing's ever gone bad in my life. And all of a sudden, I'm like thinking of not wanting to live consecutive days, at least 6 weeks consecutively. Every day I didn't want to live. And so what I learned from that experience, because I went from one extreme to not having any issues to another extreme in regards to asking my parents to take me to the hospital to protect myself because I was suicidal. That extreme, what it did, it actually allowed me to have a lot of understanding and empathy for what mental health is, and also to be able to know that there's a solution for it. So once I got my help, it actually empowered me to be able to be a voice and a representation of hope for my patients and colleagues as well. And I will say, because it is a very prevalent situation, specifically with physicians, one doctor dies by suicide each day.
Mm.
And that's like 300 to 400 per year. And that's about 1 million patients every year losing a clinician. So for me, I believe that as healthcare providers, us self-caring and taking care of mental health is going to, have a trickle-down effect for the rest of the world and society. Because if we're here, obviously we can take care of people, right? I mean, if we're not here, then we can't. So I feel like my experience with dealing with depression, anxiety, and then having my own challenges with ADHD, being I realized later on, it just give me a kind of like a credibility, or just kind of like people can believe that whatever I'm doing or saying is legit because I'm still here 20 years later after whatever I might have tried. Also, my transparency, even with my patients, has helped them get their care because they're like, wow, you're a doctor, you're doing this, and maybe there's hope for me. And I've actually seen the results of being transparent with them in regards to them feeling better. One lady with bipolar disorder, where she never wanted to take medicine, she took medicine and she was like, I never thought I would have a life. And now I actually can live. I actually don't have to be miserable all the time. I don't have to be hopeless and think the world is coming to an end. And it's not to say that everyone has to be medicated. However, you do what's necessary to function. And since my back was against the wall when I was in my crisis, I had no choice. And so that was what I learned about in school. So how am I going to learn about it and know that biologically what the challenges can be that can cause you to lose the, neurotransmitters that are important for your wellness, like serotonin and dopamine. And then I'm not going to take it myself because of stigma or because of pride. That doesn't really make sense to me. So in a nutshell, I've learned that being open and real has helped others and also a lot of physicians as well. Because lots of times when I share my story, my 5-minute summary on YouTube that has over 30,000 views that shares my situation I just described briefly. A lot of people, send me messages in DM, oh my gosh, you're so brave. I feel the same way too. Thank you for sharing that. But, no one's going to say it loud because of the stigma associated with it. So like, I kind of like to be a bridge for like not only my patients, but also like my colleagues to realize, hey, it is what it is. You're human. Get the help you need to be well. Because in my experience and thought process is mind, body, and spirit are all connected. If your mind is not okay, it affects everything else. So if you're depressed, you're not going to have motivation to self-care and take your medication for diabetes. In addition to me understanding that people with diabetes, like 25%, 40% likelihood to be depressed because there's a connection to the two. So handling your mind motivates you to handle your body, which motivates you to be overall well, because you break that cycle of, oh, I'm sick, I don't take care of myself, then I get sicker and I feel more depressed. And it's just like a cycle. So hopefully I answer your question within all of that. But the whole point is it's prevalent. It's something I'm passionate about. And to be frank with you, right before I came to join you, one of my delays is because before I came on, I want to give you specific names of the doctors who have died by suicide within the last 4 weeks. One was
Mm.
actually October 2nd. It's a African-American female. But as I was trying to go back and find her, and it's heartbreaking, there were so many that I was not aware of. I literally just Googled within my group that I have, physician suicide. And it was new ones that I had never even seen before that happened with. So in a nutshell, it's close to me. I just like promoting life and wellness. And my success with helping patients is their success or vice versa. Like I take it personal because I don't have to be here and I am
Mm, mm.
grateful.
Well, again, thank you for sharing that story with us as well, and just your journey, right? And like you said, yeah, testimony can help people through their individual tests, right? And by
Yes.
sharing that with others. And so I appreciate you doing that as well on this podcast. One thing you kind of hit the nail on the head for me was number one, physicians who take their lives. Yes, it's tragic for them and their immediate family, but then all the patients they were taking care of in that community, right? And you mentioned of the 300 or so doctors that die from suicide every year. There's over 1 million patients without a physician that's helping them.
And this
And
is also potential because we're talking about the medical spectrum. Like we're talking about medical students, residents, physicians who are already in practice. And so it's not even isolated to one group. So potential patients or that have lost their lives or future patients that have lost their
mm,
physician because the medical student died by suicide. Or
mm,
that I know there's a psychiatrist that went to my college. His name was Omar Howard, Dr. Omar Howard. He was a psychiatrist and he died by suicide 2018. So this is
mm,
way past already finishing training, already finishing practice or being in practice and die by suicide. So
mm,
it's real. And we have to realize that we're human. We can't act like we're Superman or super, above being a human.
yeah.
I mean, what makes us different? Actually, we should be expected to do this. Not expected to, but it shouldn't be a surprise because of our responsibilities, because of the load, because of the burden, and not in a negative way. I love what I do, but it's a lot. And one thing I will say is, in addition to just being transparent and sharing with patient things and encouraging them based on my experience, I also give them tips like how to preserve us as doctors. So I might give an example and say, listen, please look at your bottle with your refills, okay? You have 5 refills. So if you're calling me a month later, don't, because contact the pharmacy. You are preserving me because I don't have to stop and evaluate the situation to figure out how to help you with your medicines because you already have them. And I try
Mhm,
not to make it about me. It partly is because every little click counts, every click in an inbox counts. But I say, look, you don't have your medicine and it's accessible to you. So I
mhm,
don't like the fact that you don't have your medicine. So you have the power. So I empower patients to say, look at this. Or if it's something that doesn't require a medical degree to handle, I said, well, if they need to follow up on a referral, don't make an appointment to follow up on your referral with me. We have referral coordinators. I've given you their contact information. Follow up with such and such at this extension, and they will help you with that. So that they kind of preserve me so I can focus on the medicine practice.
Well, and I think especially as internal medicine, family medicine, it's becoming a catch-all for a lot of different things, right?
Yes.
And so I think Center for Medicare and Medicaid Services has realized that, and so they're trying to help augment, like you mentioned, doing all these things that maybe a social worker could do, right? So I don't know if you're aware, but they have CPT codes that doctors can take advantage of that can actually pay for community health workers to do all that blocking and tackling that's needed to help
Mm-hmm.
patients with social terms of health issues, right? Like,
Mm-hmm.
Medication compliance, transportation issues. So those are ways to kind of help, take that off the burden of your plate. Because I guess what we're inferring here is that, sometimes the doctors feel either the stress, overwhelmness of dealing with the practice itself, trying to manage all these different points from a patient standpoint, just puts a lot of burden, stress, and
Mm-hmm.
just unnecessary work on a doctor's plate. And there's ways they can offload that with available resources and make it in a sustainable way, to your point, where you have that resource that can help you. I think is going to be so valuable for the future of healthcare, right? Especially the front end. Let's be honest, primary care, internal medicine, a lot of that is the quarterbacking of healthcare, right? You have to get
Absolutely.
them to the specialists. You have to help
Mm-hmm.
with them with medications. Like you said, they need mental health, right? So it's a lot of things that baked into being a primary internal medicine physician. And so I think that causes a lot of stress and turmoil as well.
So for me, it's a lot, but it's the challenge that I like. I like the challenge of being in the core of kind of being the coordinator of all the everything that's happening, kind of being in the hub. But I want to be in the hub in the more of a medical practice sense, not in the hub of, for example, someone emailed me yesterday asking me about the housing referral status of a patient.
Mm,
So I couldn't look that up. However, we do have care coordinator director who they can directly be linked up with each other to be
good.
able to follow up on those types of things. And because I think it's maybe an ADHD thing because we don't like being bored. So like that doesn't stimulate me. Like if a patient asks me for the address of their referral or where the specialist, it just does something to my head. Like I can't just rattle off numbers and addresses and phone numbers because my brain is not challenged. And it's like, what are you doing to us? Like, why are
Mhm.
you like, we don't like this. So I like might find another way I will literally have a method where I can securely send them the information without me rattling it off because it just does something to me. I like the challenge. I want you to tell me that you have a lot of problems and I can help solve them, like medical.
Mhm. Mhm.
So,
Well, you want to provide the most value you can, right? Not like
mhm.
one small little concern. I mean, which is valid, for a patient who needs medications, but what's the bigger thing that we can solve, right? And help you with so that you get the most bang for the buck for the time that we spend together.
And plus
So,
time is limited as well, right?
exactly
So
that
we
too.
can't, we can't spend time on the things that don't require a physician to do when we can handle things that I can, within that time.
Yeah, so let's double click a little bit. You talking about like ways to kind of reach out to patients securely with secure apps, texting, things like that. What are your thoughts about using technology, right, to kind of influence how you communicate with patients, how you talk to them? There's some tools and technologies that allow you to do dictation, automatically with artificial intelligence. All these behavioral health tools and apps, things of that nature. What are your thoughts about that? Is that becoming too burdensome, you think, for what you do, or does it help augment what you do?
It depends on what tools we're speaking of because there's so many. As you mentioned, the AI scribe is actually something very helpful and very useful for me personally. It saves a lot of time. It's very secure, and it saves a lot of time because it takes me a while just to formulate the documentation for patients. So it takes away that burden because I don't want to look at patient as another note. That's how I see it. When I start looking at this patient as another documentation, that's when I know I'm really like on that burnt out spectrum of things. But that definitely helps with time. The thing is, I feel like there should be some regulation in regards to how much communication they have with us in a sense. I don't want to have a dialogue back and forth when it could be a visit we need to talk about. You know what I mean? So there should be some limits to a certain extent in regards to you can't give me all your symptoms and your issues and expect me back and forth through the email or through the portal to handle the issue. You know what I mean? Like, and I do believe there are some positive things that came from the pandemic in regards to the telehealth and telemedicine being available so that patients don't have to come in. But you cannot do everything over the phone or on a video. Like I can't do pap smears. I cannot evaluate your shoulder situation over the through the phone or through the video. So
No, no.
these things can be helpful if I just need to tell you your results. And like sometimes patients want to come in would follow up with me when I say, oh, I could just call you. Oh, I want to come in. No. So I will say you only need to come in if like I saw something wrong with your blood pressure, or, we're dealing with a new thing. I want to physically examine to see that it's resolved. But if I'm just telling you your results, or I'm just calling you to see how you responded on your benign prostatic hyperplasia medicine so that you're not peeing all night, I don't necessarily have to see you.
Mm.
So they don't always know when it's appropriate for those, technologies that involve the computer and not human touch. On the other hand, it is helpful. So it just depends on what it is. So to summarize my response, I think the AI scribe for sure is helpful for me, and
Yeah.
for writing letters.
Mm.
Like people, oh, I want a note for this, I want a note for that. That's very helpful for those things because you can
Gotcha.
put in
And you
prompt.
hit the nail on the head. I mean, the whole thing about physicians. I saw a statistic by the American Medical Association. They said physicians have received 57% more text messages since the pandemic. So prior to the pandemic, it wasn't as useful, but now I guess patients are used to kind of talking to a doctor via text. And doctors, as honest, are used to probably responding that way, right? Prior to the pandemic, when I reached out to doctors and talked to them, it was either phone call or in person. Now, how many times I text doctors back and forth to kind of have communications. So to your point, we're seeing ways to kind of use technology, kind of triage that a little bit better. And that doesn't have to necessarily go for you, especially if it's a question about billing, or if it's a question about medication, or things like that, refills. That can be kind of triaged and sent down the traditional path, kind of like with your calling trees, right? When patients call the doctor's office, right? Call one if you want to speak to billing, call two
Yeah.
if you need a refill. And to your point, there has to be a standard way of care. Annual wellness visits are great, so that you can kind of have them at one time and kind of have a conversation with them and basically kind of set that care plan together. But again, the time factor, right? How much
Yes.
time you have to kind of see them and really go into depth with their help. I think that's going to be key. And I think technology has a place, as with everything. And to your point, it just has to be useful and doesn't put more burden. Like, unfortunately, you see statistics about EMRs. Yes, they're great with digitizing records and getting data, understanding. But to your point, doctors became more transcribers, right? Putting data into
Yes.
boxes.
Yes.
And that wasn't great for customer care. So now we're creating technology
Yeah.
to help us of a different technology that we
Yeah.
needed. So,
Yeah.
so anyway, so to your point, I think it has to be useful. What we do chronic condition management.
hmm
So we kind of use like blood pressure cuffs and scales. They're cellular enabled, so patients can use them. So
hmm
for like cardiologists or even primary care is really worried about uncontrollable hypertension or
hmm
diabetics, you can get that data automatically pulled in. You can see trending information. So that can help. You're not getting a lot of alerts and alarms for unnecessary stuff, but stuff that's trending and you want to check how certain medications are doing with
Right.
patients is really helpful for that. And so,
Oh,
really
I
kind of
definitely
look
agree
at
with that. I mean, I
yeah.
say the patients are at home where they are more than they are with me, right? So those values are definitely helpful, because they call it the white coat hypertension when they get in the office and their blood pressure is high because
Yes.
they're nervous and scared. But so when they say that, I don't give them a pass to say, oh, they don't need medicine or they don't need to manage it, because I do have blood pressure monitors that I do distribute to patients at my clinic, and I say, check your blood pressure. I'm going to follow up with you or have someone else follow up with you in about 2 or 3 weeks, and I want you to tell me what your readings have been looking like. And I also give them the range or the value to know what is normal or not normal, so they can't get away with telling me, oh, it was good or bad. What is good? Like, what is bad, right? We need concrete information and data, because you could think good is 170 over 80, and that's because you're used to being 200, right? But that's still
Mhm.
not good. Okay, it's better, but it's not good. So I really like to educate patients so they're aware what we're monitoring, because I feel like when they know what's going on, it makes them more involved, it makes them more mindful and care and more compliant with the whole program.
Yeah. And so I think when you kind of look at where it's all kind of going, from your standpoint, especially around mental health, what do you see as important for physicians to kind of think through as they're building their practice, not just, serving, helping them with their patients with mental health, but helping themselves, right? Kind of navigate any issues that they may have. What do you recommend for as you talk on social media and communicating?
Helping themselves means helping the clinicians or helping the patient? Like, who are we talking about?
Both, yeah. So first, obviously, physician heal thyself, and then patients. What are some of the things that you're doing to kind of incorporate like a general mental health wellness programs into your practice?
Well, here's put it this way: I don't always practice what I preach, to be honest with you. And from the physician
Thanks
standpoint,
for
I
being
mean,
transparent.
I'm so transparent. Like, oh my gosh, like I'm going to be real. But it makes me real and relatable, because if I had it all together, then who's going to listen to me? Because, like, I can't attain that. It could be the thought process. I think we just have to be mindful that patients' emergency or their urgent concern is not always the priority in reality, like in big picture. So someone might be concerned about, oh my gosh, I gotta get this form filled out right now, fill this form right now. And it's actually due in a week or 2 weeks or whatever the case is.
Mhm.
So kind of like setting boundaries, really, I would say, for physicians in regards to how much they allow patients to, I don't say encroach their space, but just like affect their own flow, because we have our own pattern or flow of how things go. So if we decide, let's say I decide I'm only going to check messages this particular time. Okay, if it's urgent, I can alert my medical assistant or my front desk about what certain things I would consider urgent to bother me or to interrupt me regarding. Otherwise, at 10 o'clock and 3 o'clock, this is when I check my messages. So patients can't expect me, let's say they message me at 12 o'clock, they're not going to get a response until after 3, period. Like setting boundaries, letting patients know what the expectations are, that they should have of you and you of them as well, is kind of also important. Taking a break for lunch, eating, something I got to do. I don't always do because it's always something to do. And, so my medical assistant, she did give me a payday for lunch yesterday. I appreciated that. Because I hadn't brought mine. But anyways,
Yeah.
yeah, but so that's important, recharging, resetting. I have a post on Instagram that it kind of shows like I'm at my high battery level at the beginning of the day. And then it kind of goes down mentally because I'm pouring out, I'm pouring out, I'm pouring out. Before lunch, it's not a good time to really be talking to me, or if we are, we got to wrap this up because I got to
Mhm.
recharge with lunch or some break. And then
Yeah.
after lunch, I'm good. So I tell patients the best time for me personally to get me in my prime is like between the first 1 hour and a half of the day or the first 1 hour and a half after lunch, because that's where I'm the most juiced up. You know what I'm saying? So I give them little tips to how, like, I say, help me help you, you know what I mean?
Mhm.
So that you're
Mhm.
not frustrated because, a lot of doctors fake it until they make it or don't make it. Let's call it that way. But I don't know how to fake it. So
Mm.
I can't, and I want to give my all, I want to give my best representation of myself. So if doctors, if you know yourself and how you function, not to tell them everything, but let patients kind of get aware of when the peak times are to like address you. When I say that, meaning like schedule your appointments, schedule appointments. So say, for example, if a patient is, I see a patient and I'm really late seeing them, I'm behind at the end, I'm like, I'm going to make sure you are scheduled for 9 o'clock. That's when I start at your next
Gotcha.
visit. So I
Gotcha.
ensure that so that they are assured that I care about them. But, I'm just trying to give them the best way to navigate the whole system. For their
Mhm.
own self care, though, I've recently, and I'm in the progress of working on this, I have a little not a program, but a project I'm doing actually for my board recertification. And so mine is helping patients identify the 3 parts of their wellness: their spiritual health, their mental health, and their physical health. And so what I have them do is grade it on a scale of 1 to 5. 1 is terrible, 5 is excellent, 3 is so-so. And so for each domain, I first define what the spiritual health is, whatever your connection is to a higher power. The second level for the mental health is your relationship with yourself, which includes your mind, will, and emotions. And
Mhm.
then the third one for the physical health is how you relate to the outside world. So I have the patients grade themselves. And so based on those grades, we kind of figure out which one needs to improve. So for example, specifically, patient I checked on this week, she graded her spiritual health and her mental health as a 5. But then her
Mm.
physical health was a 3. So I asked her, why is your physical health a 3? And she said, because she has lupus and diabetes, all these other things. But for her, it was a 3 because she gets so nervous when it's time for her to give her her weekly injection of her lupus medication. She gets really
Mhm.
nervous. So what I said to her, how about this? Since you have strengths in the spiritual and the mental, why don't you pray before you give yourself an injection? And she also recognized that when she gets the injection, afterwards she feels good. So why don't you pray before your injection, ask God to help you calm down, realize and think about the benefits of the injection afterwards, so that when you time to give it to yourself, you won't feel out of sorts. Because for her, the 3 was only because of that part, because she got nervous
Mm.
for the injection. So she did that. I followed up with her and she felt good and she was able to do the injection without any problems. So my point is helping patients realize they have more than one dimension, helping them realize those dimensions and see how they can kind of use their strengths to help them work with their weaknesses for whatever those dimensions are.
No, I love that, putting structure around how they can kind of help themselves and then obviously be prepared, but also helping the physician to give insights to what's best for them to reach out for the patient to reach out to them. So what
Mhm.
times are best for them? I'm looking at these 3 T's, right? Being transparent, truthfulness, and then having a testimony and then kind of
Uh-huh.
communicating that over and over again to the patient. When you kind of have your care, I think that can help a lot of patients and physicians, especially with that communication channel. Because I think with healthcare, we're seeing is just there's so many different things, quality measures, meaningful use. You have to, you know, make sure you get your 15 minutes. You look at RVUs, how much time are you spending with the patient? How do you maximize the time so you can give them the best care possible? And I think,
Mm-hmm.
you know, what you're doing around telling your testimony so they can trust you more and understand that, providing information about the truth, like what's real and what's not, right? And
Mm-hmm.
then constantly communicating that to them over and over again, I think is really key. No, this is great insight. I think a lot of the physicians that we talk to that listen to stuff like this can take this to heart. But yeah, where can they find you on socials? Obviously, you're doing great work there, and that's how we found you. But what other things do you have planned for the coming year? Talking about your story, but more importantly, helping other physicians and other patients, right, deal with mental health.
Thank you for asking. And I like the TTTs that you came up with. Did you come up with that yourself, or is
I
that
did. Yes, I
some
did.
formula that I don't know
Yeah.
about? Before I talk about what I'm doing, I want to also add one thing that's helpful for clinicians and for patients is no matter what is going on with the patient's situation, whether they have uncontrolled diabetes or whatever the case is, I always try to find something that's good, like something that's positive about their situation. For example, I hadn't seen a patient in a long time. Well, I say a long time. I hadn't seen her since like May, and it was like October. But usually she was a little bit more frequent in following up. So she kind of fell off a little bit, was taking care of things in life, whatever. But she had lost like 20 pounds. And it wasn't in a healthy way. It wasn't stress or whatever. It was actually she was being conscientious about losing it. And she needed to because she was morbidly obese. Her BMI was more than 40. And so I was telling her, wow, it's good to see you again, but I'm really impressed by the weight that you've lost, you know? So it wasn't just like, girl, where have you been? You have been following up. What's wrong with you? Nothing like that. It was like I was able to say, okay, wow, I'm really impressed. What did you do? And kind of help her feel good about it. On the other end, let's say a patient has diabetes and that's, you know, not well controlled, but I'll say your blood pressure is good. Like I am so impressed with your blood pressure. And I make a
Mm.
big deal out of it because everyone doesn't have that situation going on. And because of my frame of reference, I'm able to see all kind of issues and challenges that I'm able to highlight what is good because you can easily take that for granted because that's not your situation. You know what I mean? So I highlight it. And let's say a patient is like, I have this, oh my gosh, he's 83 and he is like, oh my gosh, he's like on no medications.
Oh wow. Wow.
Right. And he's in his right mind. And he's, oh my gosh, woo. And I did the whole, you know, the levels of wellness for him. He said 444. And so he didn't really know what to work on. So I kind of helped him out with that. But he legit, he got his stuff together. I mean, he wasn't lying. He wasn't making up how he feels. And I mean, he wasn't saying a 5 just because I think he has wisdom to know that nothing's always perfect. I think that's probably why he did that because he knew I would have called him out on that. I'm like, no. So no. So my point is, there's everyone has different strengths, weaknesses, whatever. So I like to highlight what is good, no matter what. In regards to connecting with me, I am on Instagram at this underscore MD underscore Kalaki, Kalaki. However, my page is not really, how can I explain it? I'm a hope dealer, is what I call myself. I'm a hope dealer. I deal hope supplied by Jesus Christ, because that's my source.
That's
So,
awesome.
and it's not preachy, and it's not ADHD for life, even though it is, and it's not, oh, I killed myself almost, I want to kill myself, I'm here. It's just me being me, and whatever I can do to uplift, give hope, I'm there for that. Everything I do is intentional. It's like, what is the purpose? What am I trying to, like, what, if I show a picture of myself, it's not just to be cute, it's to have a message to it. I have like 3 things that are backlog. Sorry about your time. 3 things that are backlog for posts that are kind of old, but they're still relevant because think about it. We watch old movies, right?
Mhm.
That's my thought process. So even though I did a suicide prevention walk this year on September 29th, I haven't even posted the things about that. But we always look at history, right? We look at 9/11. That happened 23 years ago. We look at, so that's how I'm justified in my mind, even though it's an ADHD thing. I just haven't pushed the button to put it out there. And I'm a perfectionist a little bit sometimes, so that I'm not like ready for it yet. Anyway, that's where you can find me there on Instagram. Next month, actually, there's an annual ADHD conference that's happening in Anaheim, California, that I am
Okay.
going to be presenting during like what they call an innovative session. So between 2 o'clock and 5 o'clock on November 14th, I will be giving a little presentation about how to support physicians with ADHD during residency training.
Mm.
Basically, it's like a blueprint for program directors, schools, whoever, to just kind of get some insight. And it's based on my own experience. Since I found out about my ADHD during residency, it's actually just like helping them acknowledge what it is, because a lot of doctors do not really understand that it's not fake, it's real, it's a neurobiological developmental challenge. So it's not mental illness, it is a trait. Let's put it this way. Some people are tall, some people are short, some people have neurodivergent brains. So it's not a mental illness. It can make you anxious sometimes, but it's not. I mean, it's in a DSM-4 or 5 rather, as a diagnosis. As it's a neurodevelopmental condition at birth. I did not have ADHD when I turned 35 and found out about it. It was from childhood, but as a girl with females, we present differently. We're not jumping all over the walls like men can present, like the little boys. We're daydreaming. We're messy. We're taking too long to do things. We're all over the place. We lose stuff all the time. That's more so like the presentation. But then when we get older and we can't handle all the things of life, we can't mask anymore behind our intellect, because our intellect has nothing to do with our ability to do time management, prioritize, and self-regulate in those kind of ways. Executive
Okay.
function. Just a little blur on the ADHD thing. So I'm passionate about that because I'm able to educate everybody who comes to the event. And then I got asked to be part of a primary care ADHD advisory board from an organization I won't mention. That'll go to a meeting in Chicago in December. So that's that.
Well, Dr. Clarke, thank you so much for your time,
Thank you.
insights. Love it and appreciate you as well. Everyone, please take these insights to heart as you kind of deal with your own mental health, but more importantly, as you help your patients walk through their journeys. So this has been insightful. So everyone, thank you for your time. Listen again to the next podcast where we kind of help everybody navigate this new normal of healthcare. Take care.